you have a woman complain of vaginal bleeding, after shaking the hand of the patient and introducing yourself, you are going to discuss this patient's information. So you will ask the patient, what is your name, how old are you, and what is the nationality, and what is, you are married or divorced or widow or virgin. If she is married, we are going to ask about how many pregnancy and the outcome of pregnancy, and if she was using a method of contraception, and what is the blood group, and what is the RH typing, what is the job of the patient, and where do you live, and she is smoking or alcohol intake, or she taking narcotics, she is smoking or not. If she is smoking, how many cigarettes she is smoking per day, and for how many years she is smoking. Patient is coming complaining of vaginal bleeding, so we will ask about the menstrual history, when she gets the first period, and when the last menstrual period, and if her cycle is regular or irregular. If the cycle is regular, we are going to ask us about cycle length and the duration of the period, for how many days it lasts, and the amount of bleeding, and if the patient has any pain or discomfort in relation to the period or not. If the period is irregular, we are going to ask about the length of the period, coming with how many months, and the duration of it comes, and the amount of the bleeding, and the bleeding just stained or soiled or soaked or blood clots. We ask about switch change, acne, and seborrhea, and there's hair in the face, or chin, or abdomen, or chest, and if there's any milk discharge from the breast or not. If the patient has mood change or not before period, she has headache or not before period, she has abdominal bloating, she has breast discomfort, or she has leg swelling, or she is gaining weight, if there is any bleeding after the end of the period, 7 to 10 days after the end of the period, if she has any vaginal bleeding after 6 hours, vaginal douching. She has vaginal discharge or not, and she has symptoms of anemia, fatigue, dizziness, dyspnea, fatigue and dyspnea, and fatigue, dizziness, and dyspnea. When the bleeding starts, it's in relation to the period or after the period, or it is not related to the period at all. How much is bleeding, for how many days, drops, minimal bleeding, blood clots, heavy, for how many days she's bleeding, if she has bleeding after 6 or not. She has abdominal pain in relation to the bleeding or not. If there is pain, when the pain starts with onset of the period till passage of blood clots, or pain most period time, or pain start after before onset of the period and increase during period and ends after. And the pain is in the lower abdomen and iliac fossa, suprapubic and deep in the pelvis. And this pain is heaviness or colicky or dull aching or stabbing or compressing or dragging. If the pain is radiating to whole abdomen or back or to the back or lower abdomen, if she is feeling any abdominal swellings, or if she is feeling any vaginal mass, if there is increase in the frequency of micturition or difficulty on urination, if she has vaginal discharge, what is the color of this discharge? Bloody or white or mucoid or tissue? And what is the smell of this discharge? Has smell or offensive? And we ask about obstetric history. In the obstetric history, we will ask about when this pregnancy occurred, what year, and the duration of the pregnancy, for how many weeks, and many problems during pregnancy. And we ask about the pregnancy ends in abortion or ectopic delivery. If it ends in delivery, the delivery is spontaneous, breech or deliver, breech extraction, induced vaginal delivery, episiotomy, forceps delivery and episiotomy, urgent cesarean section, elective cesarean section, tubal ligation, and the newborn, male and female, how many kilo, and any obstetric complications, and any neonatal complications. And also the breastfeeding. She's feeding babies or not. We will discuss for each pregnancy. And if she has any bleeding disorders, bleeding from the gums or the nose or not, or have a pelvic ecchymosis. If she is using the method of contraception, what is this method of contraception? If she is using medication to stop the bleeding or not, hormonal iron, tanaxamic, capron, dicinone, or she is using anticoagulants or antihypertensive drugs. She has past history of medical disease, liver disease, or if she did an ultrasound before coming, and this ultrasound revealed no abnormality, liver cirrhosis, enlarged uterus fibroid, adenomyosis, submucous fibroid. If she has any investigation for the bleeding disorders or not, long bleeding time, or decreased platelet count, von Franz disease, and we will thank the patient. On examination, we have to measure the pulse rate and the blood pressures. If the bleeding is severe, we have to know the discrepancy between the pulse and the blood pressure. We should determine. We should measure the temperature, and we should count the respiratory rate, and we should look for there's pallor or not, jaundice or not, cyanosis or not. And we should look for any purple corruption, ecchymosis, palmar erythema or spider nephri, collecting liver disease. And we examine the abdomen of the patients. there is normal varicose crossing the abdominal wall, abdominal enlargement or scar, we should evaluate the size of there is any abdominal swelling due to liver, uterus or ovarian swelling, or the liver is enlarged or shrunken or hepatomegaly, and then we should examine the patient. We should inspect for the bleeding, there is bleeding or not, and blood clots or fresh or brown, and we should see the vulva if there is lesion, vulval ulcer, trophic ulcers, tumor, polyp projecting from the vagina. And we should do speculum examinations, normal cervix, threads of ventricular device, cervical ectopion, cervical erosion, cervical polyp, uterine fibroid polyps, so cancer cervix, cauliflower mass, and uterine polyp. And we should do vaginal examinations. Cervix is firm and closed, cervix soft and closed and no tenderness moving the cervix, or cervix soft and tenderness moving the cervix. Cervix internal also is open, bilateral cervical tear, cervical polyp, uterine polyp, cervical canal, uterine polyp coming from the cervix, hypertrophic cervix, and cervical mass. And then we do bimanual examination to evaluate the size of the uterus and the mobility of the uterus, and if the uterus is enlarged, symmetrically enlarged or not, and there's huge cervical fibroid or broad ligamental fibroid. And then we should look for the adnexus. The adnexus is normally not palpable. If there's tenderness or the next swelling of one adnexa, bilateral polycystic ovary, unilateral ovarian swelling, or bilateral ovarian swelling. And we should look for the Douglas pouch is free, or there is mass ovarian swelling or posterior wall fibroid. At the end, we can determine that the cause of the bleeding is uterine, or is apparent lesion, or there is no apparent lesion due to dysfunction uterine bleeding, or the bleeding is due to bleeding disorders or liver disease. So we should reach at the end to provisional diagnosis for the cause of vaginal bleeding.